Good morning. The Senate Finance Committee will come to order. Members, it's June 26, 2021, Saturday. We have Senate File 37, our Omnibus HHS bill. For the record, members, we do have a quorum. Senator Benson. Good morning.
Thank you, Madam Chair. Members, I'd like to present the delete everything amendment to Senate File 37. So that will be my first motion.
Senator Benson moves the A21-0249. Mr. Bowden.
Madam Chair and members, I just wanted to point out quickly before anyone becomes confused by it, you'll note that the header on the A21-0249 amendment references the House file. Since it's a delete everything amendment, obviously it can be offered to Senate File 37. All of the amendments that have been prepared for the committee today are drafted to the A21-0249 amendment and can be adopted that way.
Great. Thank you, Mr. Bowden. Any questions? Any questions on the amendment? Senator Benson renews her motion on the A-210249, delete all amendment. Video on, audio on. All in favor, please say aye.
Aye. Aye.
All those opposed, nay. Motion prevails. Amendment is adopted. Okay, we are in order. Senator Benson.
Thank you, Madam Chair, members of the Finance Committee. Most committees received their targets on May 17th. We received a $100 million general fund target, but wait, there's more. That will be the theme of this bill. There is more. This is probably one of the biggest health and human services budgets that you will ever see, and a lot of that is because of the impact of federal funding. In addition to the $100 million general fund target, we had to resolve how the Blue Ribbon Commission required savings would be counted, and that is reconciled on the spreadsheet. We also needed to know what was going to happen with the $105 million in the premium security account that remained in the premium security account. There were approximately $59 million of CRF funds made available to our target that will be reflected on the spreadsheet. There were also considerable funds for Home and Community-Based Services, FMAP, Child Care Block Grant, emergency MFIP funds, and that created a great deal of complexity, both in negotiations and in the spreadsheet that you'll see before us. Our challenge was how to effectively use so much one-time money from the federal government to meet the basic needs of Minnesotans as we're coming out of COVID and given the opportunity to transform some of our systems. So I hope that the committee has available to them. This will be a good reference to help you orient beyond the spreadsheet. There should be two documents. One is entitled Health and Human Services Omnibus Budget Home and Community-Based Services Special Time-Limited Funding Provisions, and the other one is Health and Human Services Omnibus Budget Allocation of Federal Funds. Members, if you go to the very bottom right.
Members, that should be in your packets, and they have been posted.
Thank you. You'll notice that we received approximately $685 million in Home and Community-Based Services FMAP. That is incorporated into the spreadsheet and appears as general fund spending, and Mr. Albrecht will draw your attention to that later. And then as you look at the allocation of federal funds, the second document, you see $373 million in the first biennium and approximately $11 million in the second biennium. So as you look at this spreadsheet and some of the transformative spending that is happening, that is the source. And we did comply with target requirements. An overview of some of the federal funds. The Child Care Development Block Grant was $141 million in the first biennium, $139 million in the second. Child Care Stabilization Fund, $342 million in one biennium. That will distort budget planning, most certainly. The Mental Health Block Grant was $13 million in the first biennium and approximately $7 million in the second. The Substance Use Disorder Block Grant, $22 million in the first biennium and $3.69 million in the second biennium. Pandemic Emergency Assistance Funds, $14.35 million in the first biennium. And then, of course, the Enhanced FMAP for home and community-based services. That was $434.67 million in the first biennium and $251.17 million in the year 2024. This does not include the ongoing enhanced FMAP that is for the general Medicaid population. When the Senate came into finance, before we went out of our regular session, there was a provision that money would be put into the Healthcare Access Fund. We did not prevail on that position, and so that enhanced FMAP you will see as a quote unquote savings from the Department of Human Services in the November forecast. And so I think that's the big picture of where the money is going. Mr. Albrecht will fill in details if there are any that I have missed. And I received a message from Senator Abler this morning that he was going to be available today. So if he appears in person, we will certainly welcome him at the presenters table. But I don't know if he's requested Zoom access. This bill was a collaborative effort of Senator Abler and myself. As you all know, he is incredibly passionate about the people of Minnesota. He believes that everyone has value. He worked towards independence. We mean it. You heard him say that over and over again. He wanted to stabilize support for seniors and persons with disabilities. He wanted to increase access to mental health and substance abuse treatment while including reforms that will be necessary. He was committed, is committed to the availability of childcare statewide. As you know, childcare providers, like so many, have had a disruptive year. And we need, for our workforce to get back, we're going to need stable and available health care. He was committed, as I was, to sustainable funds. So while the House, for example, pushed aggressively on MFIP grants, we wanted to make sure that the TANF fund that funds those grants was available into the details. The conversation details came up a number of times as this one-time money put incredible pressure at the front end to establish long-term programs with short-term money. He also fought hard, and he didn't give this as a point, but it's something that I noted. He fought really hard for this one-time opportunity to increase funding for PCAs, not just within the contract, but in the surrounding community, so that those people who need support would have support in their communities. As for me, my motivation and framework as we looked at this budget to keep the stability of our health systems as we recover from the impact of this pandemic, to respect the work of the Department of Human Services and the Minnesota Department of Health, to create sustainability in the Healthcare Access Fund, to capture lessons learned from COVID, including telehealth, which, Madam Chair, you were a leader on, to acknowledge and support the needs, the emerging needs of mental health. You saw the CDC issued a report yesterday. There has been a massive increase in young women, teenagers, showing up at the emergency room with attempted suicides. We are facing some pretty serious substance use and mental health crises in our state. The state of Minnesota had record overdose deaths through the course of the end of this pandemic. So that has put a lot of stress on our hospitals. The pandemic itself put stress on our public health system. And so you will see supports in this bill for those provisions. One of my missions was to stop the expansion of government control of healthcare. The House came in with significant carve-outs. And one of the side effects of not achieving resolution on the dental carve-out, there is a line item for dental that is earmarked in the Healthcare Access Fund. We agreed on spending levels, and we agreed on rate reform. We could not agree on accountability. And even last night, Commissioner Harpstead and I had a very straightforward conversation, thought we'd come to resolution. But then about 9:30, there were other provisions added. And so we are not at resolution on dental today. One of the reasons that I so strongly defended the stability of our current system, first of all, we are coming out of a pandemic. We have seen record utilization for non-emergent services in the first quarter of this year. Additionally, the cross-subsidy from our private market into public programs keeps our healthcare system innovative and stable. And yes, there is always going to be work to do, but I thought this year was a good year to just let everybody catch up. I am disappointed. There will be an amendment for reinsurance later. It'll be a shadow of what the reinsurance program had been. It has been an intense debate through the course of these budget negotiations. And even as we introduce the remnants of a reinsurance program into this bill, Representative Andrew Craig is working to implement a federal reinsurance program. And so while we are pulling back, Washington is moving forward. That is not how Minnesota usually works. Usually we are stepping forward. And so that will be a frustration that will ride along in this bill. With that, Madam Chair, I'm going to, my author notes are 5 pages, so I'm going to try to go quickly. Article 1, Department of Human Services Healthcare Programs. Again, we talked about dental for Minnesota Care and MA. We did expand periodontal coverage. We have a requirement for disclosure of the fee schedule, which was very important to the dentists. I mentioned that we are stumbling on the opportunity for dental. We have a new report to the legislature that will help us understand how dental is performing in the state. And there is an agreed upon provision for planning a dental home. We have healthcare homes. We're hoping that dental home will increase access. We also, for our PMAP providers, are going to require them to disclose county by county payment levels for their 5 most common procedures. And that we believe will help eliminate some of the black box feeling that there is around the PMAP program, but also make it more transparent while protecting the individual disclosure of payments to individual providers. There is an expansion of the MA benefit for asthma. That was a significant ask from the administration and the House. There's a lot of really focused work on moms and babies. As you know, the Senate had a report that will let us look at outcomes for some of this expanded spending that we're doing. We moved to the House position on MA expansion for moms 12 months postpartum. The House was at 12 and the federal waiver is for 12 months. And so it will be easier for us to accomplish that. We did a temporary funding increase for home visiting. We're going to spend energy and resources on looking at root causes. The governor's priority is dignity in pregnancy and childbirth. We acceded to high-risk pregnancy grants. We have a voluntary hospital curricula for hospitals to make available to their employees to help employees understand cultural differences in the birth and delivery process for new moms. We are studying maternal morbidity. It's really hard to ask a family at the moment that someone dies for access to all of their records, but we think that we have found a balance between the right of the individual and the need to have a better understanding of what causes maternal morbidity. We could not reach that agreement on infant death. We tried very hard. We think that will be an important next step, and the Civil Law Committee has committed to taking a look at how we balance the rights of the individual and the need for information. Under the prescription drug provision, 90-day supply for drugs would be more efficient and easier on individuals. Increase reimbursement for pharmacies. We moved to the House position for weight loss drugs, allowing doctors to treat bariatric patients or those who are facing obesity with that option. We do pay for bariatric interventions, and weight loss drugs were prohibited. If you remember Fen-Phen being advertised and people doctor shopping, that's when that prohibition came in. We're removing it. We retained Senator Dibble's formulary review provisions. NEMT We funded public transit for non-emergency medical transportation. And those of you who've been following the Affordable Care Act know the family glitch has been an issue for quite a long time. We acceded to the House position and the family glitch, which is where an employer-sponsored coverage would be affordable for the individual, but family-sponsored coverage or family coverage from that employer would not be considered affordable. Now those families will have access to exchange products. We implemented COVID waiver for continuation until federal emergency funds are no longer available as part of unwinding emergency powers in the state of Minnesota and making sure that we had access to those federal resources and also giving the department a chance to wind down some of these provisions. The Article 2 family background studies, I carried a bill for simplification of licensing of medical professionals where they could get a background check with the Board of Medical Practice and they wouldn't have to get one from DHS. The House would not accede to that provision, but we did increase access for PELSB and Navigator background checks. Let's see, family foster care background checks and training requirements were implemented. Right now, in the state of Minnesota, we have more than 100,000 non-compliant, that is non-FBI background checks. Those were waived during the pandemic so that you wouldn't have to be in person getting fingerprinted. Approximately 180,000 of those, and we are transitioning to a new system starting August 1st with, we hope, a more responsive vendor. We had to move to the governor's request of 365 days to allow for a catch-up. There is just no way that we can get enough throughput to get 180,000 background checks in addition to normal background checks completed. There's a legislative task force on background checks and significant childcare provisions that Senator Kiffmeyer had carried in. For the health department, we reformed the e-health advisory committee that resulted in some savings. We are allowing for a monthly update of the all-payer claims database and requested the commissioner make recommendation for other ways that we could use the all-payer claims database. The House had wanted to make specific provider payments available through the all-payer claims database, and we did not accede to that position, but we think there are new ways that states are using the all-payer claims database. So we're going to look at that. Senator Housley's Vivian Act was incorporated thanks to the technical help from the Minnesota Department of Health. That will be part of newborn screening. There will also be outreach to inform parents of risk of the cytomegalovirus present in mom causing birth defects. We have a hospital and doula curriculum that I mentioned. It's not mandated, but we hope that at that moment when moms are facing some of the biggest changes in their life, that we will have providers who understand their circumstance. Homeless youth access to birth records, hospital provisions, require mental health beds that are removed during a closure be the first to reopen if the system reopens beds. We expanded beds, including mental health beds for Regions Hospital, and we have 30 new pediatric mental health beds. The House had requested a number of provisions related to hospital closures. We agreed to 120 days notice of closure to the commissioner and the public. The commissioner is then required to hold a public hearing. There are significant exceptions for if there's a disaster, an emergency, or an inability to provide services. For example, you have to have a general surgeon available for your emergency room. If there's not a general surgeon available, you cannot open your emergency room and you would not have to give 120 days notice. We updated lead standards, expanded the availability of loan forgiveness for SUD providers, that is temporary funding related to HCBS with a little support, but then we dropped down to regular loan forgiveness standards. NAMI had a number of significant requests, including expanding communities of color counseling services, behavioral health boards, add rural and unrepresented members, and we acceded to a NAMI House request for CPE requirements related to communities of color. Under prescription drugs, the Senate opioid provisions except medical gas manufacturers were adopted. We did also adopt temperature monitoring reporting. As you know, as vaccines were shipped, they had to be at very specific temperature requirements. That works really well in the supply chain, but as drugs begin to be delivered to our house, if there's temperature sensitivity, for example, insulin has to be maintained at a certain temperature. How are we going to make sure that the quality gets all the way to the door? Madam Chair, your article on telehealth, one of the, I think, great lessons learned out of COVID is in Article 6. Audio only is sunset in 2023. There's an interim report at that time and a follow-up with telehealth overall. So the legislature has the opportunity to re-engage as this system evolves. Parity will have an impact on value-based reimbursement contracts, networks that are developed with tele and physical presence, very important to those folks who are concerned about maintaining rural providers. That's in here. How are they going to blend and work together? So the legislature is certainly not done with telehealth work, but we're going to let it function and go back to it. Article 7, economic supports, SNAP reforms, including counting self-employment income and fixing the error rate. More waivers expanded here, so long as there are federal funds available, and off-ramp provisions. There are emergency homeless grants and emergency shelter grants. This is where the Senate negotiated with the House to get a reduction in their MFIP provisions, but we did accede to an MFIP cost of living adjustment. You will see that on the spreadsheet. And then federal one-time MFIP funds allow for a significant one-time MFIP grant. Child Care Article 8, basic sliding fee scale reprioritization for non-MFIP families without a high school diploma, the ability to recover overpayments, CCAP rate. This was a significant debate. The Senate position was that there should be quality and we shouldn't need a lot of general fund money going into the details. Senator Abler did negotiate so that there would be 40% of the most recent market survey for infants and toddlers and 30% for the remainder of the CCAP population. This does leave some CCAP funds available into the 7th year of this. We started looking at a 7-year budget window so that as we dealt with one-time money, we tried to be cognizant of the decisions that we were making. Article 9, child protection, North Star kinship, federal compliance, and court-appointed counsel during child protection. Article 10, child protection policy, mandatory reporter in private or public use sports programs. That has a delayed implementation date. This was introduced on the Senate floor in part and on the House floor. And so the implementation date of June 1st of 2022 will give the opportunity for stakeholders who might not have been aware of this provision to come in and give us feedback. We're reinstating the legislative task force on child protection to help be a focal point for that work. Article 11, behavioral health. We have school-linked behavioral health grants. There's a change, Senator Ingebretson, this is based off of your bill, an increase in per diem for residential crisis stabilization services. There is an Anoka County Pathfinder pilot for substance use disorder programs, and we are meeting family first requirements for state foster care in our state foster care statutes, direct care and treatment, operating adjustment. Sorry, that was Article 12. Article 13, disability and continuing care. This is Senator Abler's strength. We fund and ratify the PCA contract. We also have funds available outside the contract. Elderly waiver was funded. We saw, again, during the course of COVID response, individuals living in their home independently was important, but that has been important for a long time. The more we can help our elderly and disabled live independently, the less institutional infrastructure we build in, and the more they get to live the life that they choose. Less about the institution, more about the individual. So elderly waiver and HCBS waivers were both increased in their funding. An odd provision, we limited customized living services to 24 hours per day. I didn't know there was more than 24 hours in a day, but evidently some providers were billing for more than 24 hours in a day. The miscellaneous article, we did create the Ombudsman for American Indian Families and included a parent aware evaluation. Parent aware has been around for a while now, and it's time for us to take a look. Is it having results, or is it just more burden on the providers? Under Article 15, the appropriations article, the operating adjustments are there. ICWA's there. Public health grants. The Senate had a strong position on public health grants. We had used SHIP funds, which I thought was appropriate, but we did not prevail on using SHIP funds. And frankly, with a significant amount of money leaving SHIP for now was an agreed upon decision. The public health grants are in two parts. So there's the basic public health grant that goes into an established formula. And then the Department of Health introduced new language and a new request that the remainder of the money be used for innovation, for strengthening regional infrastructure. And so the Department of Health is getting an amount of money, about $1.5 million, to help facilitate a restructure of public health. And I'm going to say, for the record, public health is independent of the Department of Health. So the Department of Health is going to facilitate the update and improvement of public health. The system has been stressed. They've learned where their strengths are. They've learned where their needs are. And now is a good time to put some money in and work on reform. The EMSRB is also in this appropriations article. The Emergency Services Board underwent a significant leadership change the day before yesterday. And in the process, we discovered that some funds had not been properly distributed, and they will cancel on June 1st. And so, Madam Chair, I do have
Senator Benson, we're going to wait on those, if you don't mind.
On the amendments?
Yes, please.
Okay.
Mm-hmm. Yep. I'd like to have Senator Abler speak and the commissioners, and then we'll deal with the amendments.
There will be an amendment that will allow continuing operations for the EMSRB. Then there will be a reinsurance amendment that will be discussed. That will be Article 15, and significant changes in the state government revenue fund. Some fee increases for radioactive materials, newborn screening fee increases, asbestos fee increases. The medical cannabis provisions that were passed in a previous bill result in a significant change to the state government revenue fund for the Office of Medical Cannabis. And then there is an adjustment within the health boards that changes some of their special revenue. So that's a very high level summary of each article. And Madam Chair, how would you like to proceed?
Thank you, Senator Benson. Yes, thank you very much for that. I'd like to turn to Senator Abler.
Well, thank you, Madam Chair and members, and Senator Benson was correct. It's a high level discussion, all those points, and that's not even all the points. So I'll just keep really high level for you all, and Michelle touched on a number of the things we did. This really is two bills. If you read today's paper in the Tribune, you'll hear about a health bill and maternal stuff. And there's a lot of amazing elements on the healthcare side. But the side that I'll talk about is on the disability services side and the human services piece. This is a bill for the ages in the human services. We went into conference agreeing on that PCAs needed a lot of attention, and the bill got better than either bill was originally to serve people, the PCAs. Eventually they'll be able to drive a car. So they're there sitting around with a person and they need to go buy bananas or some socks so they can hop into the car of the client's choice and then go buy socks and bananas. And it's as small as that seems, it's a huge deal. Something we've been trying to get for a long time on PCA was helping people with slightly lower needs to get an enhanced rate. If you need a PCA for 10 hours a day, you still can't get out of bed by yourself. And this is solved in this bill finally, and it's just a really good thing. On the grander scheme of things, on our side, if I had a title, it'd be Independence. We mean it. We were able to fund ways to help people become and stay independent. The department brought forward a thing called Waiver Reimagine, which they graciously helped us even make better. We solved a lot of the issues. There's going to be a group of stakeholders assisting the department in making it work. That's actually a breakthrough for stakeholder engagement, and I appreciate the department agreeing to that. That's going to make a huge difference in solving some of the pitfalls of this major change that's on the way toward moving people to more independent living and helping them be more in charge of their budgets and so on. Very complex. And I just want to commend the department staff in particular for their tireless work, and our staff that are amazing. A lot of amazing people, Madam Chair, in this crew. And they're exhausted, but their prowess just shone through all the way. So we also were able to support seniors with elderly waiver payment increases. There's some places that serve 80% of the people or more of their clients are elderly waiver. They were going out of business. This bill provides that they can continue doing that amazing work. Madam Chair, your effort to get some moratorium money is there. We couldn't get the $5 million. We got the $2 million, which will make a great difference still for helping keep our nursing homes in better condition than they are. Home care, which is a real challenge for families and children and seniors, I suppose, as well, we improved the rates. They just couldn't get nurses to want to go into homes. And so there's a catch-up rate, and then there's a framework in place based on Medicare. I think they'll be starting off with an 8% raise, which will make a huge difference in keeping these kids out of the hospital. And these are some compelling stories, Madam Chair, what they have. They're very fragile. They have tubes coming out of everywhere, and you could easily be in the hospital. But through the wonders of modern science and home services, they're able to be home with their family. And it's just really an amazing thing, and this bill provides for that. And then what other rate was there? Well, those are the main ones, and just to keep it really high level. But the point of and I want to commend Senator Hoffman and Kevin Parker for their work on a number of the elements here. Madam Chair, just to briefly summarize the big money in the bill, there's about $680 million of one-time money that comes from the FMAP. About a nominally, Dennis will correct me because these are just nominal numbers, but basically maybe a third of the money went into refinancing ongoing costs that we have that could be turned into general fund. Maybe 40% went into funding PCA rates and others, and maybe 10% or so, maybe 15% are on this one-time HCBS monies, which are listed, I think, in your documents. Most of that last group are one-time projects that are very interesting projects. They're not things we would have done ordinarily, but with this money that came, we thought, let's leverage some improvements in some of the nooks and crannies. And as you read through those, you'll find that those are going to be very, very useful. One thing else that we were committed to, and with this, I'll probably stop. We were very concerned about ongoing tails and the stability of the TANF fund and the Child Care Block Grant. And these are all balanced through 2027. Which we thought was really important. I would have liked to have conducted our analysis further, but no one knew how to do that. But I'm very happy to report that these are balanced out 6 years, and all the general fund impacts are noted and well visible by looking at 2025. And this is a bill for the ages, Madam Chair and members. The effect on the human services community with disability services, senior care, substance abuse, mental health, are going to be remarkable. And I'm just proud to be a part of it, proud of our staff, proud of all the members, proud of the Senate for their work and pushing on this part and actually at the end prevailing. So thank you, Madam Chair.
Thank you very much, Senator Abler. Good work to the both of you. Okay, Senator Benson, what would you like to do? Would you like to go to the amendments? And then I was thinking of perhaps the commissioners or Mr. Albrecht. What would be your preference?
Madam Chair, the commissioners are waiting. Let's let them address. And then Mr. Albrecht's going to be here for the duration, so we'll move to him next, and we can go to amendments.
Wonderful. Good morning, Commissioner Malcolm.
Good morning, Madam Chair. Thank you very much. And Senator Benson, good morning. Senator Abler, it has been a privilege to work with this this conference committee and then this work group. I think Senator Abler calling this a bill for the ages is not an overstatement. I think there are tremendous wins for the health of Minnesotans in this bill. Certainly, many of the initiatives on the human services side, as we know, directly affect health as well. But this is also really a great bill for prevention and for the public health system. And I want to thank all of the members of Senator Benson's committee and the Finance Committee, and indeed the whole Senate, for your recognition and your support for public health in this past year and a half. Senator Benson rightly calls out local public health. They are the boots on the ground, the people directly interacting with Minnesotans to try to give them good information, give them the services that they need, and protect their health during this unprecedented time. And just to further explain what Senator Benson laid out, the increase in the existing local public health grant fund is very significant. It's about a 30% increase over what had been the base, and that funding continues on. But in addition, I'm very grateful for Senator Benson's support of the innovation fund, or the funds that will help us to really transform and strengthen the entire public health system. Senator Benson's right to say it was a new part of these negotiations, but it's not exactly new work. The State Community Health Services Advisory Committee, or SHAC, has been working on this notion for several years, and the ability to use some of these funds to pilot new approaches for local public health agencies to work together, which the current formula does not allow, or to partner with tribal health and to figure out what is the best combination. How do we leverage all the resources and all the expertise in the public health system as a whole? What things need to be done at the local level? What could perhaps be regionalized? What things do the locals rely on MDH to provide in terms of high-level epidemiology, certainly the laboratory, things like that. So we very much look forward over these next couple of years to accelerating this that we've been about for a couple of years and bring back to the legislature really a modernization plan for all of public health. And that is a transformative opportunity for the public health system. Senator Benson mentioned a very strong package of initiatives in both MDH and DHS to strengthen maternal and infant health. And there's just not much we can do that is more powerful from an upstream prevention perspective for lifelong health than to strengthen maternal and infant health. And there are some really excellent initiatives in here, including, as Senator Benson mentioned, strengthening the newborn screening program. I also want to really say I appreciate Senator Benson's very consistent approach to wanting to evaluate the effectiveness of programs, whether it's the home visiting program or some of these upstream causes of maternal and infant poor outcomes and death, unfortunately. So studying these issues, I think is going to be very important to helping shape policy for the long run. There also are a number of really important environmental health protections in this bill that certainly do directly affect moms and infants, but also really all Minnesotans, including lowering the level of lead in blood samples that triggers a more in-depth analysis and strengthens our ability to order remediation for elevated blood lead levels, as we've learned that indeed there's really no safe level of lead, especially when it comes to small children. So very much appreciate that. And then finally, also in the realm of working upstream to try to prevent still some of the major causes of illness and premature death in our state, the additional investment in tobacco and vaping prevention is very much appreciated as Clearway sunsets at the end of this year. We have continued to make really good gains in reducing traditional tobacco use among our youth. It's at an all-time low from the last student survey, but those gains were more than erased by the epidemic of vaping. So this will be the first time that we really will be able to put together a comprehensive plan to address some of the nuances and the differences in the youth vaping epidemic as well. So there's a lot in this bill that we are very grateful for. Those are just some of the highlights. And I thank you, Chair Benson, very much, and members of the committee. And thank you, Senator Rosen. Happy to answer any questions if you have them later. I'll be around for the hearing as well. Thank you.
Thank you, Commissioner Malcolm. I think you do have a very, very good bill in front of you. A lot of hard work. Hopefully we are past this crisis, and we can. This bill will address a lot of the current and ongoing issues that we were facing, and very troubling what Senator Benson was saying about the huge suicide rate. So we all have to take a look at that. Any questions for Commissioner Malcolm? Well, thank you very much, Commissioner, for your time this morning.
Thank you.
Commissioner Harpstead, good morning to you. Welcome to the committee.
Good morning. Thank you, Chair Rosen, Chair Benson, Chair Abler, and members of the committee. Thank you for your time this morning. This budget, which started back in the fall with budget cut scenarios before the November forecast and ends with a meaningful investment in health and human services, to say the least, is truly one that will serve the mission of the Department of Human Services, which is that working with many others, we help people meet their basic needs so they can live in dignity and achieve their highest potential. It has something in it for Minnesotans of all walks of life. We're very proud at DHS to have centered children in our budget work this year. Prior to this bill, our Child Care Assistance Program, or CCAP rates, put us on the border of federal noncompliance, and it took us over 30 years to increase our Minnesota Family Investment Program, MFIP, payments once. This bill includes important maternal and infant health provisions, as have been mentioned already many times. A COLA and one-time cash payment for families on MFIP to help them climb out of COVID and out of deep poverty. An increase to CCAP childcare rates that puts us out of federal non-compliance territory. We appreciate how these provisions will support the Walz-Flanagan vision of Minnesota being the best place for children to grow up. This bill also includes a healthy package of services for people still experiencing homelessness coming out of COVID. A variety of provisions to allow older adults and people with disabilities to live independently as long as they would like, such as an age-friendly Minnesota Commission, an increase in elderly waiver services, support for the PCA industry and other home care and home health agencies, an earlier inflation adjustment for DWRS providers for people with disabilities, phase 2 of Waiver Reimagine. Behavioral health investments such as case management redesign, substance use disorder service reform, mental health uniform services and standards. A major investment in telehealth, incorporating all that we've learned through COVID, 90-day prescriptions, as we also piloted through COVID, improvements to the child and teen checkup program, and ensuring access to public transportation for people on medical assistance. We are grateful for the operating adjustments for DHS and our direct care and treatment services, a list of items that keep Minnesota in compliance with federal regulation, always important, resources and policy changes to ensure our background studies division has the infrastructure needed to meet the needs of providers, investments to help us get back to better as we stand back up programs coming out of COVID, and payment of the tribal MAT and county IMD overpayments from 2019 to put those two issues to rest once and for all. We're grateful for the federal funds that contribute to so many Minnesotans and Minnesota organizations coming out of COVID and out of economic hardship. And I'd like just to thank our HHS committee chairs who slogged through a boatload of federal funds with us and came out understanding more about the inner workings of DHS than perhaps they ever wanted to. But we will all be stronger, more informed partners for having plowed through this exercise together. We're very eager to put COVID, payment errors, shutdown planning, and this budget session behind us, and to roll out this extraordinary investment in the lives of the people we support. Thank you very much.
Thank you so much, Commissioner Harpstead. Yeah, this has been really some kind of year, hasn't it? Is there any questions for Commissioner Harpstead? I want to thank you too for all your hard work. You work very well with our chairs too, and it's, I think we have a very good bill here. Any questions? I hope you two can stay available as we go through the spreadsheet. And then we have some amendments too. Senator Benson, would you like to have Mr. Albrecht go through the spreadsheet?
Yes, Madam Chair.
Okay.
Thank you,
Mr. Albrecht. Are we starting off with the spreadsheet that is dated 6/23/21, 12:12 p.m.?
That's correct, Madam Chair.
Okay.
One thing that the Human Services spreadsheet does not convey is what the total amount of general fund spending is. It tracks the change items, but not the total amount. So I will provide that now. There's $16.376 billion in the 22-23 biennium that's appropriated in this bill. The planning estimates for 24 and 25 are $18.266 billion. I think before I get started on this spreadsheet, I kind of wanted to give folks an overview of where all the money came from. Senator Benson did a really good job. But if you were to go through this carefully with a calculator, you would say there's more money here than it appears. And a big reason for that is with that $686 million that came from the federal government for HCBS services, one of the first decisions that the chairs made was to take $188 million of it and apply it to provisions that are already in law but not yet implemented. So that had the effect of displacing forecasted general fund spending and instead using federal dollars to pay for those provisions. Senator Benson mentioned the target. We often, and at this point in session anyway, start looking at our numbers as four-year numbers. So in addition to that $188 million, there was $200 million for the targets, $100 million each biennium. Senator Benson mentioned the $59.5 million from the Coronavirus Relief Fund. There was $100 million related to the decision to basically not meet the requirements of the Blue Ribbon Commission and instead take the money out of the reserve and use that in this bill. There was a decision that the committee made to delay in the next biennium, the 24-25 biennium, an inflation adjustment that's in law that brought in $25 million. And there was another, I think like $7 million of fiscal year 2021 amounts that were canceled and carried forward, general fund amounts that were canceled and carried forward into fiscal year 22.
Mr. Albrecht, what is the total funds, all funds? You said 16.37 billion of general fund and 18.26 in the next biennium. What's the total funds, all funds?
Pardon me, the all funds total?
Mm-hmm.
Madam Chair, on the spreadsheet, that's the top line, at least all of the funds that we track. There is actually more than this. Oh, actually, that's the all funds changes. You know, I don't know the answer to that question, to be honest with you.
You know everything. What the heck?
Madam Chair, you stumped Mr. Albrecht.
I was just doing a percentage.
It's a lot more. The federal fund is, you know, another close to $20 billion, I think, on top of that.
Our, it's about 30% of what we're spending on general fund for our total budget, 31% actually.
And I believe Human Services is 45% of the all funds budget.
Okay. Senator, Mr. Manel? Yep. Okay. Thank you. Mr. Albrecht.
So Madam Chair and members, I'm going to be, so my understanding is that you only want to talk about things that are new or different that weren't in the Senate bill before. So I'm not going to go through every 42 pages of this document.
Thank you, Mr. Albrecht.
Just want to make sure I have the correct understanding. So on the columns on the right-hand side where it says special session, those are the ones I'm going to be focusing on. One thing you might notice right away is that the amount in the general fund, and that's on line 6, is $129.55 million. That is offset by the savings in fiscal year 2021 in the general fund of $29.55 million, which carries forward into 22 and 23 to net out to the $100 million target. And then you can see for 24, 25 that the increase in the general fund is $100 million. Lines 18 to 26 track the healthcare access fund balance. And at this point, this is before the reinsurance bill. And I'll be honest, I'm not quite sure what that does to the healthcare access fund. The balance is $94.73 million. On lines 28 to 32 is the TANF fund, and that balance is $47.2 million. The next section of the spreadsheet tracks changes in medical assistance, and then the change in appropriations for all of the agencies in the jurisdiction.
And Mr. Albrecht.
Senator Benson.
Under Madam Chair, Mr. Albrecht, under management and budget on the second page is where you see the $59 million transfer from the CRF. I just want, as we're talking about these pots of money, I know Mr. Albrecht will call out other line items, but this is a unique circumstance. I just want people to be aware as we go through the spreadsheet.
That is on line 93.
Line 93. Yeah.
91 and 93.
Madam Chair, on page 3 is the first change item that is significantly different now than it was when it left the Senate. And it's one of the items that's detailed on this sheet here that you have that talks about the federal allocations. This is the child care assistance provider rate increase. It is not general fund spending. It's in the child care development block grant, except for a small amount of systems money. And that is the amount for the child care rates is the amount on line 139. So nearly $102 million in the first biennium and $139.5 million in the second biennium. Moving on to page 5. This is on line 214, and it goes with line 225. So the Senate position included an amount on line 220 to reimburse counties for the reduced federal share, and the decision of the working group was to take the Senate position without that and to combine it with the House position on the next page on the top at line 225 that included a similar amount of money for a similar purpose. But the details were just sufficiently different that it should be two proposals on the spreadsheet. Right after that, on page 6, on line 233, this was not in the Senate position. It's the governor's recommendation relating to complying with federal requirements for a North Star, and the amount is to repay families for payments they made to the state that they were not required to make under federal law. On line 249 is a governor and House position related to improving the state's errors in determining supplemental nutrition assistance program eligibility. On line 264, this was a what we call a no money budget provision. It affects the way money is spent, but doesn't have a cost. And this was one to clarify some public assistance statutes. On the next page, page 7 at the top on line 256, and related to that on 275 were some House provisions relating to childcare regulation modernization. The first one is for childcare centers, and the second one is for family childcare. This section of the spreadsheet is sort of jumbled because both the House and Senate came in with very similar provisions funded differently. And those positions were moved around even more in the conference committee and the working group. So there's a sort of hodgepodge of things that were funded in the general fund and the Child Care Development Block Grant Fund and the Federal Stabilization Fund, and they've all sort of been rearranged and come back in a different, the same proposals, different amounts of money coming out of different funds. Most of them, if they were pretty much the same thing, I just kind of have glossed over them unless they are new to the Senate. So if you have any questions about anything on here, I'd be happy to stop and talk about it, but I'm just going to continue with the initial sort of approach. The next change is on line 291. This is a new provision that was not in any position to use Child Care Development Block Grant money to pay background study fees for child care providers. It's a one-time expenditure of $4.5 million. All of these items that are in the Child Care Development Block Grant that are appropriated in the first year of the biennium are available for all 4 years of the biennium.
Senator Benson, Mr. Albrecht, where did this come from if it wasn't in the House and the Senate then?
Madam Chair,
And the governor?
if I could, we have been requiring people to do state-only background checks, but as they come into compliance, they'll need to go back and do a federal background check. And it's an added cost, not at their fault. And with the availability of one-time federal funds, we thought it was appropriate to assist them in coming into compliance. And so that's where this money came from.
I see, okay. So it's not additional background checks, you're just helping them out with the fee?
They will have to do the FBI background check in order to come into compliance. They've already paid for a non-compliant background check.
Okay,
And so this just evens that out.
okay, thank you. Mr. Albrecht?
Madam Chair and members, the next change is on line 295. This is administrative funding for the Department of Human Services for all of the allocations the legislature made from the Child Care Development Block Grant. On the next page is on line 330. We're now on page 8. In the middle of the page, there is a provision for teach grants. This was a House provision, and the conference committee or working group came back with $2 million allocation out of the Child Care Development Block Grant for that purpose.
Mr. Albrecht? Senator Ingebrigtsen?
Thank you, Madam Chair. Mr. Albright, before we get too far here, going back to the family child care regulation modernization project, in that particular area, I'm not sure really what I'm looking at here, but you're familiar with the legislative audit that happened about 2 years ago where there was a lot of fraud going on, a lot of fraud that was talked about, and I guess they supposedly nipped it in the bud. Is that anywhere as close to where you're talking here on page 7?
Mr. Albrecht or Senator Benson?
Madam Chair and Senator Ingebrigtsen, the problems in the CCAP program came through a lack of oversight from the Office of Inspector General. The Office of Inspector General has undergone significant reform. We continue to keep an eye on it, but they did a complete restructuring And the new Inspector General takes compliance very seriously, as do, I believe, the internal auditors at the Department of Human Services. But the legislative auditor remains engaged at the Department of Human Services because we went through a number of years where compliance was not a priority. And so they're moving to a structure at the Department of Human Services where compliance and the expectation of accountability is built in. And so we hope that in the coming years, we will continue to see improvement. But CCAP in particular, through the Office of Inspector General, is improving. There was fundamental reform in the way that compliance is observed there. We'll continue to keep an eye on it, but it is getting better.
Thank you, and Madam Chair, just a real quick follow-up. I know there was some reimbursements. Did that ever happen?
Senator Benson.
I think as far as the court.
Madam Chair, Senator Ingebretson, getting back reimbursements that were improperly sent out did not happen. It was quite expensive and difficult. Chasing down people who committed fraud did not end up being a prosecutor's priority. And there, in fact, was a woman who committed fraud, I believe, in CCAP and PCA, who fled the country.
Thank you.
Mr. Albrecht.
Madam Chair and members, we're moving on now to page 9. The commissioner, I think Senator Benson also mentioned this on line 359 is the one-time payment for the Minnesota Family Investment Program. This on this sheet of federal funds here, this was now paid for in the working group with an allocation from the American Rescue Plan Act called Pandemic Emergency Assistance. It is on line 54 of this related sheet. And it's a $435 one-time payment to MFIT families. On line 383, Senator Benson and the commissioner both mentioned this as the governor's proposal for an MFIT cost of living adjustment. On line 392 at the bottom of that page is a House position relating to the homeless youth report. On the next page, on page 10 at the bottom, was a governor's proposal and a House position to begin redesigning the case management system. Senate did not have that, and it's now come back.
Mr. Albrecht, real quickly, just back to the homeless youth report. Is the Wilder Foundation doing that, or who is doing that, Senator Benson?
Madam Chair, Wilder has done it in the past. I'm sorry, I don't recall who's doing it, but I believe it's ongoing.
Okay, thank you.
Madam Chair, it's updating the report that was done in 2007, which I think was done by Wilder. I'm not sure if that's who's going to do it this time.
Okay, thank you.
We're on page 11 now. Near the bottom on line 466, it's a House position relating to culturally informed and the culturally informed and culturally responsive mental health task force. The next items I want to talk about are on page 13. Near the middle on line 541. These are proposals in the federal mental health block grant that will be awarded consistent with the commissioner's work with a stakeholder group, where the stakeholder group gives recommendations to the commissioner of the kinds of grants that the commissioner should make from the federal mental health block grant. And the next item on line 545 is an amount for the Department of Human Services to administer the federal mental health block grant allocations that are in this bill.
Mr. Albrecht, I hate to do this to you, but Senator Benson, I'd just like to go back to line 495, the housing support rate modification. Is any of it wasn't carried in the House or the governor because did they have something in the Senator Draheim's bill? Do you know? It was a Senate provision only, and it prevailed, looked like, but not quite to the amount. But
Madam Chair, I think this was a compromise provision. I don't think it relates to Senator Draheim's bill.
There's nothing, okay. Interesting.
So, Madam Chair, the reason it's a smaller amount is the Senate's original position was a $100 per month increase for housing support providers, and this is now a $50 per month increase for
how much?
50.
50.
50.
Oh, sounds like a good program. Okay.
Members, we're now, excuse me, on page 14, I think.
Mr. Albrecht, Mr. Nauman just said, I love this budget. I'm like,
everybody loves this budget. That's why they're here on Saturday.
No, not everybody loves this budget.
No, there are some of us who are still nervous about the details, but we're at where we're at.
That's exactly right.
It's page 17 of 40 or 14 of 42. We're making progress.
That's right.
Line 575 is similar to the previous one, where the commissioner has a stakeholder group to advise her on the substance abuse block grant. And this is an amount that would be allocated to recommendations from that group. And then on line 579 is also an allocation for administrative expenses for the federal substance abuse block grant. At the bottom of that page is on line 592. The commissioner mentioned this. It's the second phase of the waiver reimagine project at DHS. It was a House and a governor's recommendation that the House had, and it's come back. On the next page, on page 15, on line 602, this was some additional work on waiver reimagine that emerged during the conference committee and the working group relating to residential choices that people who are on the waivers have access to. On the next page, on page 16, the next proposal is the homelessness grants and projects. The Senate did not have an allocation in its bill. The governor and the House did. And an amount similar to the House is what has come back. On page 17, Senator Abler mentioned, why don't we start on page 16. On line 672 is the PCA rate increase that all three positions had, and what has come back is that particular one is sort of a combination. I'm sorry, actually it's the House position. The dollars are the House position. The reason I drew your attention to that is because these next three are a series of proposals all deal with the PCA program. So that one is the rate increase that is associated with the SEIU contract. Then there was this online, on page 17, on line 685, is a House position relating to a new PCA rate framework. And on line 607, or 697 rather, is a provision that came about as an option once the guidance for the home and community-based services money came out, and that's the one that relates to the $688 million. And so these sorts of proposals like this one that presented an opportunity that wasn't available to either the House, the Senate, or the governor. These are the kinds of things that the conference committee and the working group chose to take another look at with that additional amount of money. And this is one of them, which allows, it says CFSS providers, that's a new terminology for what most people think of as PCAs to drive the recipients of PCA services to appointments and to get paid for doing that.
Mr. Albright, I have one question, if I could, I think this is something that everybody understands, the PCA service rate increase. What percentage increase is that? Can you tell me? I know there's a lot of talk about them needing an increase. Can you tell me what kind of an increase this is percentage-wise? Just overall.
No, I don't know.
I don't
recall
the number. I can't.
We can go offline. That's fine.
Yeah, sometimes this happens with budgets are set based on we're aiming for this % increase, and other times it happens based on this is how much money we have, and then it backfills to the increase. And I'm not sure this was on Senator Abler's side, and so I'll get back to you.
Thank you.
Madam Chair, Senator Benson and Senator Ingebrigtsen, our committee during session spent pretty much a whole committee hearing trying to understand the difference between rate increases and rates and such. I'm sure I see Ms. Johnson sitting back there smiling away. She would be happy to come and explain it to you along with Mr. Monahan, I think.
And the commissioner's still here. So if you'd like 2 hours of headache that you will leave not having more education, we could do that. But I think we probably have better use of
Madam Chair, Madam Chair, thank you. I've got time.
I think Mr. Nauman would enjoy participating in that one too.
Madam Chair, I'll just send the link to Senator Ingebrigtsen when he's fishing. Perhaps tomorrow he can play it.
You can talk it on the floor.
Yep.
When it comes back.
Madam Chair, continuing on, still on page 17, line 709. This is a proposal to advance an inflation adjustment currently scheduled for July 1st of 2022 to advance it to January 1st of 22, so by 6 months. And then related to that is to delay the July 1st, 2024 inflation adjustment by 4 months to November 1st of 2024. On the next page, on page 18, near the bottom on line 756, this is an item that was not in the Senate position. It's labeled disability grant reductions, but the only portion that has come back relates to line 760 and line 762, which moves money around between the state quality council and regional quality councils. On the next page, on page 19, on line 768, is a House position for the Parent Support for Better Outcomes grants. The next item is on page 20. In the middle, on line 823, is a House position for culturally and linguistically appropriate services grants. On the next page, on page 21, in the middle on line 868 is a position that looks new, but it was actually hidden in a House provision that's tracked elsewhere This is a rate add-on for substance use disorder providers for culturally appropriate services. And on line 876 is the substance use disorder provider payment modifications that were different in, you can see in the governor's recommendation, the House and the Senate's position, and what's come back is something between the House and the Senate position. At the top of page 22, the commissioner mentioned this item. This is the repayment of the MAT overpayments and reimbursements of counties for payments relating to institutions of mental disease. Line 901 is the direct care and treatment operating adjustment that was not in the Senate position. Line 925 is related to the item above it. And it's a report on safety net services. Senator Benson mentioned the Vivian Act, which was modified in the process of the conference committee and the work group to contingently be included in the newborn screening panel. And this would be the MA cost attributed to the fee increase that would come along with adding this item to the screening panel.
Mr. Albrecht, before you head any farther, I'm sorry to take you back to the page 21, line 891, the increased funding for schooling mental health grants. It must be in some other area of the bill. Is that correct? Yes, I thought we did address.
Yeah, Madam Chair, that is on this list of federal funds.
Oh, I see.
And I skipped over it because I'm pretty sure that what came back was the Senate's position just funded. In fact, I think it was the Senate's position the way it was funded too.
Okay, thank you.
At the bottom of page 22, on line 939, Senator Benson mentioned the MA coverage for weight loss drugs. On line 9, $4.8 million that would be combined with another $7 million, I think. So the total amount reserved for dental proposals at some point, maybe later today or in the future, is about $61.1 million.
Senator Benson, can you explain that again, what we're up to here?
Madam Chair, the House, Senate, and Commissioner agreed on a dollar amount and changes to the rate structure, including retaining CAD payments, but eliminating other special categories of reimbursement. We approached agreement on a benchmark, but last night we could not achieve agreement on a benchmark that would then result in a trigger going to single administrator. And so with that, we remain at an impasse, but we want the money to remain available so that as we continue to work, we hope it will send a signal to the public that we are serious about changing dental access in Minnesota for MA and Minnesota Care.
Mm-hmm. Thank you. Probably have a few words to say about that on the floor, but I really appreciate taking this on. Dental is tough. Dental is.
Madam Chair, I spoke with the commissioner last night. She and I agree. We have both learned things that we never wanted to have to learn. So,
Senator
but it's all in good service and trying to get to the right answer. So we'll keep doing
and
this
dental
work.
is so extremely important. I used to joke that I'd rather pass pass another Viking Stadium bill to work on dental.
And Madam Chair, we do have agreed upon payments for periodontal. We know that that is a significant reason that people end up in the emergency room. And so we hope we see some change in trajectory there.
Yes, great. I'm very glad you've got it earmarked though. So thank you. Anyway, okay.
Madam Chair, continuing on, we're still on page 24. On line 1014 is the not correctly labeled family glitch provision that Senator Benson talked about. It's not the Minnesota Care Family Glitch. The family glitch is in the Affordable Care Act, and this proposal addresses it by providing Minnesota Care eligibility to individuals who fall into that sort of glitch of affordability determinations with respect to family coverage versus individual coverage that is in the Affordable Care Act.
Madam Chair, this was a significant concession to the House. This is something that has been on their list since the passage of the Affordable Care Act, and so since 2013. This is a significant concession.
Okay, thank you.
The next item, Madam Chair, is on page 25, near the bottom. It's on line 1061. It was a House position for an enhanced asthma benefit for children. Next on page 27, near the bottom, this was one of the resources of general fund money that came into the process. On line 1140 is a cancellation of both a 2020 and a 2021 appropriation for the assisted living report card that the department was unable to complete because of COVID. So that amount is canceled and carried forward, canceled in the general fund in 2021 and then carried forward and made available in 2022 for other purposes. Senator Benson mentioned the proposal on line 1144, which relates to grants for integrated care for high-risk pregnant women. This was the governor's recommendation that the Senate did not have that is now coming back. On the next page, on page 28, similarly on line 1165, it's a governor's proposal relating to compliance with the interoperability and patient access regulations. This is a federal requirement that was a governor's recommendation, not in the Senate. And it's coming back. On line 1184, this is a House position. Most of you probably know this as the Hennepin County proposal. The Senate had language, but had not at the time had a fiscal note for its position. The House did. I think the House had slightly different language. What's come back now is the House position, the House language, and the savings attributable to it. The next item at the bottom of page 28, this begins a section of a number of items that are in, I think it's Article 16. This is a collection of grant proposals for the most part that a significant portion of the HCBS FMAP was used for. I should point out that about, I think it's 73 or maybe 78% of that entire $688 million or $686 million was invested into forecasted programs. So while this is a number of proposals on the spreadsheet, it's not a very significant part of the overall total. The first one on line 1192 is grants for technology for HCBS recipients. On the next page, page 29, is on 1199 is a proposal to develop an individual portal for HCBS recipients to access information about their case and their case plan and such. On line 1203 is a housing transitional grants. On line 1212 is the transition to community initiative. This is modifying a grant program that's currently in law to make it, I think, a little bit more expansive and help folks who are stuck in some of the state's hospitals, like Anoka, to move out of those facilities and into the community. Line 1219 is an amount for lead agency, which is counties mostly, lead agency process mapping. The commissioner mentioned the one on line 1226, the age-friendly Minnesota grants, which comes along with the council to advise on the allocation of those grants. Line 1233 is an amount for housing stabilization administrative costs. Line 1238 is a proposal for continuity of care for students with behavioral health and disability support needs. On page 30, on line 1243 is this is one of the larger grant programs that came out of this whole process to help build provider capacity in rural and providers of HCBS services, I should say, in rural and underserved communities. Line 1251 is an expansion of mobile crisis services, which is a current service. 1258 is a new proposal for mobile PRTF and child and adolescent mobile transition units. PRTF is Pediatric Residential Treatment Facility, in case you don't know. Line 1262 is a proposal to reduce reliance on children's congregate care settings. Line 1267 is titled Moving to Independence. It's a proposal to help providers phase out the minimum wage in their programs. Line 1278 is a proposal for a report and research on access to long-term care services and financing of the long-term care system. On the next page, on page 31, on line 1284, is additional funding for respite care grants and the Own Your Own Future study. On line 1292 is a rates study for MA outpatient and behavioral health services. On line 1300 is a grant program through the Minnesota Council for Independent Living? Centers for Independent Living. Those are the folks who build ramps for folks and stuff. Line 1306 is a Department of Corrections and Department of Human Services initiative. Line 1311 is workforce development grants for HCBS providers. That's the end of all of those, that sort of section of stuff. Now we're moving on to other regular HHS items. On line 1323, this was new information that came to us during the conference committee process that the federal government had enacted some requirements related to expanded MA coverage during the time of the COVID pandemic. Senator Benson mentioned the proposal on page 32 relating to FBI compliance requirements. That was not in the Senate position, but is now coming back. Line 1346 came about in discussions between the House and the Senate around prescription drug policies and such. And this is a proposal to reduce co-payments for brand name prescription drugs. On line 1361 is a governor's proposal relating to background studies. This includes the fee increase, but not the transition to a fee schedule that is outside the law. On line page 33, line 1372 is one of those no money positions that relates to a withdrawal management licensing fee. It was not in the Senate position. On line 1374, it's related to the Senate position. On line 1377, this is the repeal of a statutory transfer in 16A.724. It's a $122 million transfer each year from the Healthcare Access Fund to the general fund. The House and Senate both had this provision, just with different dates. What has come back is a third date because there is a big difference between June 30th, 2025 and July 1st of 2025. So this is now repealed on the first day of fiscal year 2026.
Mr. Albert. I'm going to turn to Mr. Nauman too. Mr. Albert, I'm going to turn to Mr. Nauman on this various issue.
I'm sure I was just turning on my camera. Madam Chair, members, it's worth highlighting this point because under current law, if there's a balance in the Healthcare Access Fund, it transfers $144 million. Sorry, Senator Marty. It's worth highlighting for the Senate Finance Committee that under current law, there is a $144 million transfer if there is a balance in the Healthcare Access Fund every year to the general fund. So what this provision will do is reduce, and Mr. Albrecht has a footnote to this effect. So it's not as if it's being hidden in any way, but I just, in the interest of full disclosure, that will reduce in the future years the general fund by $144 million each year, assuming that there is a balance.
Just
Mr.
a
Albert.
slight correction. It's 122 million each year. It's 244 for the fight.
Thank you, Mr. Albert.
Mr. Albert.
Madam Chair and members, the next item is near the bottom of page 33 on line 1402. This is the DHS operating adjustment that the Senate did not have going out and is now included. On page 34, the next time you see this spreadsheet, the item on line 1423 will look a little bit different. And I believe Mr. Nauman wants to talk a little bit about this. I did mention that during the process of the conference committee, there was a decision made at the leadership level to set aside the requirements of the Blue Ribbon Commission and to let the conference committee move forward with the assumption that there would be a $100 million transfer from the budget reserve to the general fund. That doesn't really show on here the way it's presented right now in the special session columns, but like I said, that will be corrected the next time the spreadsheet is published.
Thank you, Mr. Albrecht. Mr. Nauman.
So Madam Chair and members, under current law in fiscal 21, the budget reserve stands at 2.3. Also under current law, there is a draw of $491.4 million that will happen on July 1st of this year. And that's a residual from the 2021 budget agreement. That's still in law and that will happen. And this will draw an additional $100 million from the budget reserve. So the budget reserve basically on July 1st will go down $591 million and will land at roughly $1.785 billion under the current forecast. The tax bill, I believe, contains a provision that will bring the budget reserve back up to the current level if there are resources in the November or February forecasts. So it's handled in that mechanism. When that provision was agreed to by the leaders, it was originally assumed that the shortage in the budget reserve would be the 491. So effectively, this provision in combination with what's going on in the tax bill will generate a future forecast cost of $591 million. I just want to pause there and make sure there are any questions about that.
You can find this on Article 15, Section 18 and 19.
Okay. Thank you, Madam Chair.
Yes. Any questions to that? Senator Franson.
Thank you, Madam Chair. That's hard to follow, but in one sweep. But and I don't know if you can track it with any of the spending in the budget spreadsheet. So can you elaborate a little bit about that? I believe what we took reserve money a while back was for reinsurance, but I'm not 100% positive.
Mr. Nauman.
So Madam Chair and Senator, maybe we pause on the reinsurance conversation until we get to that amendment. I think maybe the way to synthesize some of this is that in the last year's budget agreement, or 2 years ago, there was an agreement for the Blue Ribbon Commission to search through the entire budget area and recommend $100 million of savings. And had those savings been adopted by the legislature in this budget, there would have been no need to backfill with budget reserve. Instead, the global agreement had an approach for this budget area to instead take the money from the budget reserve to support the spending in the bill. Does that help?
Further questions? Mr. Albrecht.
Madam Chair and members, directly related to that is that this bill does include $12.798 million worth of recommended savings from the Blue Ribbon Commission. Neither the governor nor the House nor the Senate could or did come up with $100 million. Line 1427, this is the $686 million worth of enhanced Medicaid money for HCBS services that we have all been talking about. It's important to understand, I think, that the way this works in the budget is it is an additional 10 percentage points federal contribution for 1 year on state expenditures for home and community-based services. And the way in our budget that the federal share is treated is as an expenditure reduction. And so this is the amount of that expenditure reduction that is projected. It is likely to become a different amount in the November and probably the February forecast. But this is, again, based on the current projected spending for the 1 year that this amount is available. This is the amount attributable to it. On line 1442, we're still on page 34. This is the governor's proposal that was also in the House, and a portion of it was in the Senate related to the cost of transitioning from DHS's activities under the governor's executive orders that were issued under the peacetime emergency, transitioning from those to regular operations.
Senator Benson.
Thank you, Madam Chair, and for members of the committee. I believe that this was an appropriate use of federal money that had been provided for COVID-specific transitions. However, the House and administration prevailed, and one of the key reasons, if you look on your spreadsheet, there's something called an FFP. That's federal money that we draw down, and they did not want to forego that federal money. So it's being implemented this way and not just using straight COVID relief funds.
And that's why it didn't come out of the governor's money. Exactly. Okay, thank you. Mr. Albrecht.
Madam Chair, that is the end of the Department of Human Services.
Any questions on this for Senator Frentzen?
Thank you, Madam Chair. And I know at least Senator Marty and I on this committee have served on HHS on our side of the aisle. And I have to commend you, Senator Benson, and all the staff that has worked on this bill. This is a behemoth, and that's how I would describe it. And I think it's the fundamental piece of government to deal with people's health, to make sure that we have a healthy population. Without it, we don't have a healthy workforce. We don't have healthy students. It's just the foundation. So the work here in the spreadsheet is, I know you couldn't cover everything, but it's quite amazing as I keep going through it, all the things included and how creative some staff can be to help us get to the crux of the issues we're trying to do to not just recover, but come out of this stronger and leverage all these federal funds in this bill in this time for the future. So I like to hear, like that I heard that you're looking not just at this biennium, but then next one and future cliffs, if you will. I do have a few questions, but I'll leave some for the amendments. But one in particular is I know that we talked about one of the agreements that I wasn't privy to, but want to make sure that since it's tracked on this spreadsheet on line 991, I believe, it's the House File 41, which is essential workers compensation. Is the agreement, can we clarify if it's going to be included in the tax bill? Because it's part of what we've been hearing, but since it's tracked on the spreadsheet and it's at zero, I just want to make sure we have it on record of what the intent is.
Senator Benson.
Thank you, Senator Franzen. House File 41 was a mandate on, and I'm most familiar with the hospital systems, that they would have to provide both retroactive, the equivalent of paid time off, including child care, time missed for child care absences, and then forward-looking paid time off. And rough back of the envelope calculation, that would be about a $370 million mandate onto the hospital systems. And so that is not included. The impact that it shows on House File 91 on this spreadsheet is just the impact to the state operated programs here. And so it's not reflective of the cost of the system overall. There is another pot of money that will be going to those frontline workers, people who were most exposed to COVID, who had to be present in public through the course of the pandemic. But, and I don't know how the negotiations will go in that group, but I would take this opportunity to say it's important that we don't put a mandate onto the healthcare system, that if we're going to spend the money, we spend the money and not push forward a mandate for reimbursement for paid time off, et cetera. And so we did not adopt the House provision on House File 41. And I believe the funds that are traveling in the tax bill will be a separate operational implementation than what would have been part of that bill.
Thank you, Senator Benson. And Senator Franzen, that is, it's been negotiated. It will not be complete until we start working on the next 1.2 billion of the ARPA money, but it will be a bipartisan working group working on those grants to the frontline workers. Senator Franzen.
Thank you for the clarification, Senator, Madam Chair and Senator Benson. We might have a difference of opinion on how to deal with this issue, but certainly know that it's appreciated that we are tackling those workers that obviously sacrifice a lot to get us through in one way, shape, or form with ARPA dollars, or if state dollars need to be in place. I am not opposed to that either. I do have a few other questions. One is, I know in I think how I've been tracking SHIP funding has not been cut, just didn't find it in the spreadsheet. Just want to make sure. I know we have a difference of opinion.
That's health.
For there. Okay, so that's a good one. And then I want to thank the provision for parenting with disabilities. That was a very important provision, not only for Senator Abler, but myself. He started the work. He passed it on, the baton, to myself. And I want to thank Karen Parker, who's Senator Hoffman's LA, who worked to help track all this as well. He did a great job, and Senator Hoffman as well. And our researcher, Liz Stein, for our side of the aisle as well. And I think the Parenting with Disabilities pilot project hopefully will be part of this, how Minnesota treats parents with disabilities as parenting being activity of daily living. So I look for, hopefully that will be, it's a $1 million time, but hopefully eventually we can find the merits that it would actually save money and help a lot of families. And I have a lot of other questions, but I think I'll save them for the amendments. But overall, I've never voted for a perfect bill, and certainly not in HHS. There's some delays and back payments, but we as a body have moved forward, and I'm feeling pretty positive that I can, even with reinsurance, we'll get to that I'll be able to support this because of the transformative change. Hopefully we could do more, especially with essential workers. But thank you, Mr. Albrecht, for all the work you put in, Mr. Monahan, and all the Senate law folks that have been putting so many hours in this bill. This is a behemoth. It's a very important part of our state budget. And again, I think it's the fundamental piece of the job that we're doing here. So I appreciate and look forward for more commentary and discussion.
That's a perfect word for this bill. Thank you, Senator Benson.
And Madam Chair,
Senator
not to pile on, but you do remember we had a significant policy bill that passed during regular session that would have been part of this had we not moved agreed upon language. So there's been, we'll do thank yous for staff on the floor, but most of these people have been just killing themselves for the past year and a half, and it's time for a break.
Yeah, absolutely. Yeah, absolutely. Any
So,
further
Madam
questions?
Chair and Senator Frenson, there is more.
But before we go there,
That was only one agency.
before we go there, I do have a couple questions.
And Madam Chair, if I could comment,
Benson.
the DFL caucus has gained Senator Murphy, who is definitely an expert in health and human services. And so the team.
And now she
got
sits on
stronger.
ag, so I don't get that. Hey, it works. It's nice to have her here.
Madam Chair, did you want to continue with the
I do
Department of
have-
Health, or do
I
your
do have a
questions?
compliment and I have a question. So let's go with the questions first on the the home community base, HCBSs. You don't have tails. Thank you very much.
Well,
On that
Madam Chair,
past
there
2024.
are the provisions that you see on those home and community-based grants do not have tails, but there was some general fund supports. So
Right.
that are in forecasted programs. And so I don't want to be misleading.
Okay.
Home and community-based services did support some tails based, some ongoing programs, forecasted programs, and there will be some tails impact. We tried to minimize it.
And some of these are, well, most of these are new programs. Is that correct? And
Yes, Madam
how,
Chair.
and where is the accountability? Is there any measure of accountability or coming back? I don't want to do a study because that always costs money. So-
And Madam Chair, the outcomes will have to be measured by the legislature. And in all candor, there was so much money that we tried to do one time. There just weren't existing one-time programs that could be funded. But the commitment, for example, to enabling technology, taking this opportunity to say, if you want to transition from more institutional-based care to independent living. How do we be technology supportive and making that money available? So that was the window that was placed on these funds. And had we had 6 months, there probably would have been language that would have been more robust and would have met your needs. But we were short of that standard.
I know I don't have to remind you of that because that is a priority of yours for sure. So thank you. And I would like to thank Commissioner Malcolm and Commissioner Harpstead and the staff and you, Senator Benson, Senator Abler, for making sure that we do not have the language in our appropriations that says available till expended. Like we saw it in the jobs bill. That is, you did it right. So thank you for being pure on your expenditures on that and your appropriations. Thank you. Any further questions?
Madam Chair, we still have the
Department of Health. Absolutely. Yes, Mr. Ulrich.
Madam Chair, on the accountability topic with respect to the HCBS and FMAP, my understanding is there's significant accountability provisions built into the federal regulations that come along with that money. The state is required to submit a spending plan. The state is required to submit quarterly updates to its spending. One of the things I didn't emphasize is that the basic federal requirement for that $686 million is that 686 comes in, the state has to turn around and spend that entire $686 million on eligible activities. And that is represented by this long list here that totals up over 4 years to almost $686 million. So with that, continuing on with the Department of Health, again, focusing on primarily on items that are different than when the bill left the Senate. On line 1472 is the agency's operating adjustment. On the next page, on page 36, is a transfer of $300,000 to the public health response account, which restores its balance to the amount when COVID began. Senator Benson mentioned the amount on line 1522 for lead risk assessments. Senator Benson also mentioned the item on the bottom of that page on line 1545. This is a state government special revenue fund appropriation for the medical cannabis program, for changes to that program. And then at the top of page 37 on line 1549 is the appropriation related to previously enacted provisions relating to dried raw cannabis in the medical cannabis program. In the middle of that page on line 1572 is an item that was a House position that has come back modified for home visiting grants, for an increase for home visiting grants. On the next page, on page 38 in the middle, Senator Benson mentioned also this change related to the all payer claims database. Below that is a House provision relating to homeless youth birth records. On line 1622, this is an appropriation cancellation and carry forward for an amount that was initially appropriated to the Department of Health in the 2019 Senator Rosen's opiate response bill. This was the amount for a grant, I believe, to Hennepin County for a non-narcotic pain management, I think, study. It was a one-time appropriation. They have not been able to spend it all so far. And so this cancels the unexpended portion and makes it available to them to continue those activities in fiscal year 2022. Line 1626 is a portion of the additional investment in local public health grants, I think. No, it's not, sorry. This is a house position for cultural community continuing education grants. On line 1630, Senator Benson mentioned the additional investment in the health professionals loan forgiveness. This was a house position. On the next page, on page 39, on line 1638, is a house position, the Supporting Healthy Babies grants. On line 1643, these changes are on the same line as the House's House File 660 called the Dignity in Pregnancy and Childbirth Act. But if you look at the detail, it's a combination of elements of that bill, but also other things. So there are three components to it now. The anti-racism curriculum, which was in the Senate bill, funded a different way. On line 1645, on line 1646 is maternal mortality reviews. That was a different line before the conference committee. And on line 1647, the midwife and doula provisions, which also were a different line in the House position coming into the committee, but has moved to this proposal now. Well, I shouldn't say that. The second and third one were not part of the Senate position going out. On line 1657 is the new local public health funding distribution framework. And Senator Benson did talk about this. There are two components to it. And you can see on line 1659 is $6 million a year for public health infrastructure funding. And on line 1660 is $1.5 million a year for public health system assessment and oversight. Line 1669, Senator Benson mentioned the amount for tobacco and vaping prevention. Line 1673 is one of those non-money budget items relating to an electronic transaction fee for vital records.
Madam Chair. Madam Chair, Mr. Albrecht, under 1670, how much was the Clearway funding that's going away now? Do you know what they're?
Mr. Albrecht?
Madam Chair, Senator Marty, I don't remember.
Madam Chair,
Senator Benson?
their request was 15 million, I believe,
For the biennium.
biennium. And the Senate's tobacco and vaping provisions were originally carried in the tax bill. And when they were dropped from the tax bill, we picked them up here.
Thank you.
Senator Brits?
Madam Chair, thank you. Mr. Albright or Senator, back up to 1643, Dignity in Pregnancy and Childbirth Act. Can you explain? Those are three new appropriations, it's three new programs.
Senator Benson?
Yes, they are. The curriculum was a request from the House. The Senate did adopt an amendment in Health and Human Services, and we took it out of an existing grant program. But this will be developed by the University of Minnesota and be made available for hospitals. And then the maternal mortality review is a provision I mentioned earlier for the Department of Health to look at causes of death when women die during childbirth or shortly thereafter, trying to get at some of the root causes of those deaths. There is a disproportionate impact on some communities, and understanding root causes could help us reduce that significantly. And then the midwife doula provision grants to help midwives and doulas. Many women are now opting to have midwives or doulas at their delivery. And if you are a community of color, you might not be able to find a doula or midwife who shares that cultural experience. So we tried to accommodate at that really important point in time that women would have what they needed.
Thank you.
Mr. Albrecht.
Madam Chair, that's the end of the Department of Health. There are just a few items in the health-related board section. There was House File 970 contained a provision requiring certain licensed professionals to take some continuing professional education. And the amounts in here relate to the cost of the boards to track whether or not those members of their boards have complied with the requirement for the continuing education. And so the boards involved in that are the Behavioral Health and Therapy Board on line 1691, the Board of Marriage and Family Therapy on line 1717, and the Board of Psychology on the next page, page 41, on line 1751. And then I see also on line 1755, the Board of Social Work.
Okay. Wonderful.
And Madam Chair, on the last page, though it is the last page, there is an important piece in here under the lines for Minnesota management and budget. This is where the $59.547 million is tracked for the allocation of previously enacted general fund appropriations to the coronavirus relief fund, and then canceling those general fund appropriations and making them available to this bill for some of the proposals that I've gone through here today. And I think Mr. Nauman wants to talk a little bit more about the details of that.
Thank you, Mr. Albrecht. Mr. Nauman.
So Madam Chair and members for the Senate Finance Committee, you'll recall yesterday on the state government bill, there was a provision that I referenced that said that there was a total of $117.88 million, that of which part was going to be carried in the Health and Human Services bill. This is that part, and it scores at 59.5 million dollars, which meant that the balance in the state government bill was scored at 58.3, because what's the cost of the remainder after this bill is the price of the provision that's was in the federal funds article that we discussed a few days ago. Yesterday in the House on the jobs bill, an amendment was added that also spends $5 million of the coronavirus relief fund money. So as we've talked about just moments ago, the price of the state government provision is the total minus what's in the HHS bill, minus anything else. And now there is $5 million that's in play. So that would drop the price of the state government provision to $53 million if it were enacted or included in the deal. It presumably will come back to the Senate, and the Senate will have to make a decision about whether to conference committee that or whether to accept the amendments by the House. If the amendments are accepted, then the provision in the state government bill drops to 53. It's worth keeping that in mind.
Senator Benson. Oh, you look like you were going to speak. No?
No, Madam Chair, I'm just in awe of how much money is being moved around and where, and that Mr. Nauman can actually track it and explain it.
Exactly. Okay, so we can certainly entertain questions on the spreadsheet as we go, but I know we have some amendments. Currently, are there any questions that need to be addressed? All right, thank you, Mr. Albrecht. Senator Benson, you have, would you like to do the technical ones first and then we'll get to the reinsurance one, or what would you like to do first?
Madam Chair, I don't have an actual technical amendment, but I guess I'll start with the A8 because it is the most straightforward. I do believe so, Madam Chair, I'd move the A8 amendment.
Well, I'm sorry, Senator Benson, it said technical on my sheet, so this is, all right. Senator Benson moves the A8 amendment to the amendment, Senator Benson.
Madam Chair, members, the A8 relates to the EMSRB ambulance training grants. As I mentioned, they're undergoing a leadership transition at the EMSRB, and these grants were not distributed, and so we need to cancel them and reappropriate them, and that's what this amendment does.
And this is just something new that popped up within the last
This
10 days, maybe, last week.
Tuesday, today's Saturday, so Thursday.
Oh, geez, okay. Any questions on the A8 amendment? Okay, members, we're going to take a vote. Oh, Senator Johnson, sorry. Senator Ingebrigtsen.
Thank you, Madam Chair. So could you explain that a little bit better? These funds weren't appropriated?
Senator Benson.
Thank you, Madam Chair and Senator Ingebrigtsen. The funds to the EMSRB are appropriated every year, but they need to be distributed by the EMSRB board. These were not distributed, and it was discovered in the course of some other changes that are happening at the EMSRB. So I received an email, I believe Thursday night, sent it to Mr. Albrecht, and he helped with Mr. Monahan to craft this language so that funds that were not distributed remain available. We can't just carry them forward. We need to cancel and reappropriate.
Senator Ingebrigtsen.
So to understand, they'll be still available then?
They'll still
Senator
be
Benson.
available, but they would have canceled June 30th and
Madam Chair.
fall to the bottom line at that point.
Thank
So
you.
to go to the general fund, Senator Ingebrigtsen. Good. Okay. Further questions? Okay. Senator Benson renews her motion on the A8 amendment. All those, please say aye.
Aye.
All those opposed, say nay. Motion prevails and A8 is adopted.
Thank you, Madam
Senator
Chair.
Benson.
Let's go to the A5. Home and Community-Based Services, Federal Medical Assistance Percentage Maintenance of Effort. I'm going to take a shot at this and then I'm going to get corrected. The Home and Community-Based Services funds that we have been talking about.
Senator Benson, hold on. We do not have
Oh,
that.
the A5. I apologize. We received late notice that it was agreed upon.
We'll wait till it gets passed
At
out.
the
It
House.
is posted. It is posted, members. Senator Benson, we're still posted, we're going to give people a chance to look at the A5. Let's do the A6. That is purely
Okay.
the technical one.
And Madam Chair, I don't know that I have the A6. I have the A3. So if I could get a copy of maybe A6. Oh. This looks technical, Madam Chair.
It's just technical. That is the technical one.
Madam Chair, I'm going to have staff look at this and see, I think I'm going to ask for a staff walkthrough. It appears to be just changing references or designations of patient versus individual. And so it appears to be technical, but I'd appreciate a staff overview.
Mr. Ulrich, if there's anything you'd like to add or point out.
Madam Chair, Senator Benson, this is really not my area.
Oh,
Would be Mr. Monahan or Mr. Bodern, I think. But my understanding is this is the technical amendment.
yes. Sorry. Okay. Exactly. Mr. Monahan, thank you very much for being here.
Madam Chair, members, as Mr. Albrecht said, this is the technical amendment. These are mostly things that were pointed out by DHS or some of the other agencies, mostly changing some terminology. There's an effective date that was required because the provision was dependent upon federal approval. There are some conforming changes at 1.15. I'm sorry, skipping back at 1.14 that is deleting an undefined term in the statute and replacing it with the actual defined terms. 1.16 was a request from the ombudsperson for American Indian families. 1.17 is language to make sure that certain appropriated money is available to a date certain. The string of effective dates that you see beginning at 1.19 onto the next page are all contingency planning on the part of staff in the event that this bill is not signed until June 30th. That would have resulted in all of the changes to the 2021 appropriations, such as the EMSRB provision we just discussed, from perhaps being problematic and not being implemented. And then the change at 2.15 and 2.16 is correcting an omission on my part from an earlier version of the drafts. That would have been very, very expensive if that had been left in.
Very good. You might as well stay there, Mr. Monahan. We might have some questions on the A5 coming up too. Thank you. Any questions on the A6 technical amendment? Okay, Senator Benson.
Madam Chair, I'll move the A6.
Senator Benson moves the A6 amendment. Members, all those in favor say aye.
Aye.
All those opposed, nay. Motion prevails. The A6 is adopted. Now, Senator Benson, the A5 amendment.
Thank you.
That has been posted.
Madam Chair, and I am so glad Mr. Monahan's at the table, but the expenditures from the federal enhanced FMAP related to home and community-based services, if properly expended, give us the opportunity to draw down future FMAP for home and community-based services. But we don't know if we're following every single rule, and so we might end up not being able to draw down everything that is projected. And this amendment is supposed to give the department the opportunity to inform the legislature, but not go get general fund money to backfill in the event that the enhanced FMAP for home and community-based services comes up short. So that is my understanding of what this is supposed to do. I'm going to ask Mr. Monahan to explain it to the committee.
Thank you, Mr. Monahan.
Or maybe
Madam Chair, I think
everybody's passing the bucket explaining this amendment. I'm sorry, Madam Chair, we got this morning and we're trying
I'm sure
to.
Mr. Monahan
pretty
wants to
good.
stay as far away from this
Mr.
one
Albrecht.
as possible. Madam Chair and members, there's a remote possibility that because of timing issues or other unanticipated things, again, because like I said, 78% of the $700 million is in forecasted programs. So the situation could arise in the November or February forecast where something goes wrong. I think the most likely thing is a delayed federal approval, for example, of something. And so these estimates all assume that everything's going to go right and that we will be authorized to implement all of these changes, worth $600 million on the schedule that we imagine. And if we're not able to do that, it could be possible because of the way this money was all appropriated, that it doesn't cost the right amount of money. So let's just say it costs $100 million less. What the A5 is trying to do, and I think Mr. Naumann would say not well, is ensure that that money does not fall to the bottom line in the general fund and require the legislature to pay for those items again because of the fact that we budget to the forecast. And so this is an attempt to ensure that in the event that things do not go well, whatever amount is attributed to the items in our state spending plan under this HCBS FMAP being less than we thought it was going to be does not get dropped to the bottom line, which would be inconsistent with the federal requirement that we turn around and spend every dollar that we get. But again, I think Mr. Naumann would point out that there are, it's not a perfect effort, but it is our best effort at this late date.
Thank you. Mr. Naumann.
So Madam Chair and members, I don't have a lot to add here. I think Mr. Albrecht has covered the waterfront here, but I think it's worth saying to members that this probably will be a work in progress. As he identified, there are things that are not known relative to the federal requirements of the HCBS program and how that money gets spent. This is an attempt on the part of House and Senate fiscal staff to ensure that there is compliance with federal law, but we're not sure that we've entirely nailed it here. So I think that this will be something that this committee and the legislature as a whole will have to deal with in the next session as well, and maybe before if there is a special session.
Thank you, Mr. Naumann. Are there any questions to this? Okay. A work in progress, leap in faith, but I think it's in the right direction. Absolutely. Senator Benson, have you moved the A5 amendment?
Madam Chair, I'll move the A5.
Senator Benson moves the A5 amendment. Members, all those please say aye.
Aye.
All those opposed, please say no. Motion prevails. The A5 is adopted. Okay, Senator Benson.
And Madam Chair, to the A3.
And that is in your packet. It is in your packet and it is adopted. So Senator Benson.
Madam Chair, the A3 amendment.
Posted, I meant posted.
That's okay.
Let's
not get ahead of ourselves.
Sorry. You're all like, what?
It would save me a lot of stress, but no, I'll walk through the amendment. Madam Chair, the A3 amendment represents an agreement. There we go.
We are all good.
Represents an agreement tightly negotiated with leadership and the Department of Commerce. This does not reinstate reinsurance as it would be most effective. It does use the funds available in the premium security account to do the best we can with those remaining funds, but this reinsurance plan will not have the market impact that a funded reinsurance plan would have. And as I mentioned, the federal government is actually discussing implementing a reinsurance plan, and we have no path to have a reinsurance plan for the 6th year and ongoing. If the federal government should make reinsurance funds available. What this does, Madam Chair, is through the premium security account, the MSHA board is given new guidelines, an attachment point of 50,000 and a cap of 250,000. The coinsurance rate of 60% is estimated to use all of the funds available in the premium security account. The fundamental flaw, the Department of Commerce would not allow a provision that said when federal funds become available, for example, through the BHP or additional ARPA funds, that this could be modified by the board to further impact rates for people in the individual market. There's been significant conversation about the current administration's cap on premium rates within the exchange, but there has not been a lot of acknowledgement that there are people who buy individual insurance coverage outside the exchange. And without some sort of protection, they will see a significant increase in rates. This does something for that population, but certainly not the impact that a full reinsurance plan would have for that population. That population includes individuals who work for an employer who wants to support them having health insurance so they can buy it on the individual market, but does not have an employer-sponsored plan. So if you are a small employer with 2 or 3 employees and you want to give them some premium assistance, they buy outside of the exchange and do not gain the benefit of the cap on affordability that's offered through the exchange. This is their only path to not being hit with historic rate increases for this year. It does not propose a 2023 plan year option. And so if there is enactment of some reinsurance plan at the federal level, Minnesota will need to implement something that allows for that enactment. It does modify plan year proposed rate filings because at this late date, the plans have already filed preliminary rates, and this will allow them to update their plans for July to July 9th of 2021. The date this section becomes available on enactment, and those rates will become public. Will be available from the Department of Commerce on July 23rd, 2021. We have requested a continuation of the state innovation waiver. As you know, this particular chapter, the 1332 waiver, was allowed in the Affordable Care Act. Other states have applied for it. We are the first state applying for a continuation, and so we are in uncharted waters when it comes to renewing this application. And then, Madam Chair, Section 5, the transfers for reinsurance, the transfer of $79 million from the general fund to the Healthcare Access Fund is, I believe, based on the estimated impact that reinsurance will have on the BHP. And so we're backfilling to make up for that impact. The commission, then there's a transfer of approximately $5.9 million from the premium security account to further mitigate the impact of loss of BHP funding. Let me remind members, there was a letter to CMS asking them to review the current provision for BHP impact. They had told us in 2017 that we would be held harmless, and then in October of that same year, the Treasury Department said that they would not hold us harmless for BHP impact. They are going through a rulemaking process now at the federal level to decide if they're going to maintain the current position for BHP impact when it comes to reinsurance. We're one of 2 states in the nation that have a basic health program that would be impacted this way by reinsurance. And so we are sort of a unicorn in this space, and they need to do some special rulemaking. Let's see, the next transfer, Commissioner of Management and Budget, $3.8 million to MNsure, because MNsure makes their money off of a withhold from premium rates. And it baffles me. The governor's budget didn't acknowledge that there was a change in MNsure's income, and yet here they are asking for money for rate reduction. And it's in here, but I consider it still unresolved, and we'll have to work with MNsure on why the discrepancy. Let's see, the Commissioner of Human Services in consultation with Commerce and MMB, reviews federal funding for the state basic health plan, which is in a trust, and to see if in fact the federal funding for the plan has been modified to account for the benchmark premium as impacted by the Minnesota Premium Security Plan. Let me see. If the commissioner determines that the BHP funding that comes in through the basic health program is less than the combination of 75 million and then the 5 million from the premium security account, then that will be transferred to the general fund and premium security account in proportion. With that, there are reinsurance appropriations for the commissioner to update the continuation of our waiver, again, a one-time appropriation, and then appropriation from the Healthcare Access Fund for 2 years for the impact that this will have on Minnesota Care. And members, I do have concerns that the Commissioner of Commerce take this seriously. There was a waiver that the legislature asked for in 2017 that was not submitted in a manner that indicated the Commerce Commissioner wanted success. The reinsurance waiver previously submitted was successful in obtaining the innovation waiver, and I hope that the Commissioner of Commerce will submit this waiver in that light. It is important that we all participate to help mitigate the impact of the loss of reinsurance that it will have on those individuals who in particular are outside the exchange and are going to see significant increases in rates. And so this is, I consider it a shadow of what our reinsurance program has been, but it is the best we can do in this negotiating environment.
Thank you, Senator Benson. Mr. Nauman.
Madam Chair, thank you very much. I'll just make a few comments to dovetail off of some of the items that Senator Benson just discussed. Her introduction to this amendment makes my job a lot easier. Yeah. I can just deal with the accounting, which has been a bit of a challenge on this particular item. The global agreement between the majority leader, the speaker, and the governor is that there will be $188.1 million spent on a 5th year of reinsurance. The trouble is that the money is not in the right place. So there have to be a collection of transfers to move the money around and incorporates resources from revenue replacement in order to get the dollars into the right place. It may be helpful getting a message to unmute myself. Is that what I'm supposed to do, Dal? I'm sorry.
No, I think you're okay.
Okay, as long as folks can hear me. At the very bottom of the tracking sheet that we have in your packet, you'll see on lines 46 and 47, the difference for the biennium. That's the $188 million. And the primary location from most of the resources are initially from the State Fiscal Recovery Fund. That's the federal money from the ARPA Act in the form of $83.1 million. And the Special Revenue Fund, which is a catch-all for the premium security account. That's the balance in that account right now. Together, those equal $188.1 million. It's worth noting that on line 4, Mr. Fisher, we can go up to the top. That $83.1 million from the State Fiscal Recovery Fund was dealt with yesterday, the day before, maybe, in this committee, when members will recall that there was $550 million in the original governor's agreement, increased to 633. That's the 83.1 that's being talked about here. That gets transferred into the general fund, becomes revenue replacement, and then gets transferred out in a collection of places, most importantly to the Healthcare Access Fund, to offset, as Senator Benson talked about earlier, the loss of funding for the BHP when you have a reinsurance plan. As Senator Benson mentioned, there's a letter that is gone to CMS to ask for a different reinterpretation of the loss of BHP funding. If that occurs, the language of the amendment on lines D, E, and F ask for a reevaluation and an examination of that decision if it occurs. And if it does, then money will get reimbursed to the general fund as well as to the premium security account. So that's the operations of those paragraphs. There's a collection of appropriations for administrative purposes to the Department of Commerce for a waiver that's on line 10 of the spreadsheet. Senator Benson talked about the reinsurance administration from MNsure. That's on line 21. Those prices all have to come out of the total 188. So it gets offset in that manner as well. The total loss for BHP and the Healthcare Access Fund is $85 million. So there are two primary transfers that accomplish that. One is primarily from the general fund, and the other is from the premium security account because the agreement didn't have enough resources in the general fund. So the premium security account will contribute almost $5 million for that. That's a lot of movement of money, but we think that we've corralled it. This sections 5 and 6 have been worked out with MMB as well as House fiscal staff. That language has been vetted and we're fairly comfortable we've got all the money in the right place to reflect the agreement. So Madam Chair, thank you very much for that opportunity.
Senator Murray.
So Madam Chair, the soundbite version of this is it's complicated.
It's very much so. We have Mr. Nelman and Mr. Albrecht here and Mr. Button. Thank you. Any questions? Oh, Senator Ingebrigtsen.
Thank you, Madam Chair, and thank you for that explanation. I had several questions there about where that money was going and how it was going to get there, and that was very clear. Thank you very much, Mr. Nelman. The second question I have, Madam Chair, is to Senator Benson. The Section 6 appropriation, you talked about the Commissioner of Commerce. You're hoping that, I think you said you're hoping that a waiver is completed. Is there, or has there been an issue, or if we're going to appropriate that much money, we would expect that, I guess.
Senator Benson.
Madam Chair, and it was an editorial comment. There was a waiver that was requested in 2017 that was essentially a letter, and then CMS said no, and that was the end of the conversation. The Department of Commerce did a much more diligent job with the first reinsurance waiver, and I would expect that they would do that level of work and follow through with this innovation waiver request as well. We know that this is not a priority for the administration, but if we are going to give them this money, then I wanted to make it clear that there is an expectation that they will work diligently towards the goal that the money is appropriated for.
Thanks.
Correct. Senator Franson.
Thank you, Madam Chair and Senator Benson. I think it's not only complicated, the issue has evolved over time in terms of reinsurance. And when the federal Obamacare came through, the original framework included reinsurance. It wasn't adopted. And so states were left to do what we did in Minnesota, was adopt our own reinsurance plan. And we were one of the first, put a significant amount of money. And that's why I asked my earlier question of how do we originally fund reinsurance? Because it's important to where we are today. And I do not know those numbers off the top of my head. I'm sure we can get them from our fiscal staff. But the fact of it is that fast forward to today, we have ARPA funds that now allow Minnesotans to, through MNsure, to pull more premium tax credits. And I mentioned this on the floor recently. It reduces net premium costs at 8.5% of income, of household income, and it's using the benchmark of the benchmark plan. And I'm not going to go into all the details because it's confusing for myself too, but basically, people should not be paying more than 8.5% of their household income for healthcare. In just plain and simple, the way they do it is through MNsure in Minnesota. Other states have their own version of MNsure, and that is the tool that, if you use that platform, you're able to bring in those benefits. I don't know what the number is of people that you mentioned, Senator Benson, that are not using MNsure, because if I was a consumer, which I am, and I did not have healthcare, and I get credits by using a platform, I would use that. So I am not sure how big that number is. It's certainly important that we get people to use MNsure to draw those dollars, because that's what the system that we have today. But that is why I've said I'm not opposed to reinsurance, but I question, as the dynamics and the times have changed with this new framework at the federal level, whether it's necessary or whether we have to double dip essentially in two different programs at the cost of $85 million to our basic health plan. Which was a setback when we were told that we were going to have to pay more than what was originally intended with the reinsurance program when we originally passed it. So I remain skeptic. I'm not saying this isn't necessary, but I haven't, especially drawing from so many buckets of money, I really would almost challenge any of us to restate what Mr. Naumann said about where all this is coming, because it's truly very innovative to make it work. And it should be simple. And I think it should be more transparent to the public of where those dollars are coming from and why, regardless of whether a waiver hasn't been granted or not. We should know what the real cost of healthcare is. And I think reinsurance to a certain extent hides it a bit. And we don't even tell the insurance plans to abide by a certain percentage of lowering premiums. So we're giving money without more strings attached. And I want to be accountable for those dollars. Yes, there's been help, but how do we quantify it? Every plan does their own thing. We just send the check. Yes, they do have to come back and tell us that they're using this appropriately. But in this point in time, is this the right use of $188 million? I'm skeptical, but I know this is an agreement that was done with the administration, so I am going to abide by the agreement. But I will be one of the most skeptical people continuing to push of why this is necessary. And if not this, what, right? Because we do have to make sure that people that are buying in the individual market don't have this extreme price tag at the end of the day, as we saw a few years ago, because we all got those emails from constituents that were farmers in particular, that were their small businesses on their own. They're trying to have a business and raise families, and they were hit with astronomical costs. So the issue is cost, but just feeding money from the state to backfill that is not going to solve the underlying issue of healthcare expenses in Minnesota. So again, I just would want to ask for one question is, what is that number of people that you're talking about that also Senator Dames asked in the floor, that people who don't buy through MNsure? How many are those? And we should probably tell them to buy through MNsure so they can draw these dollars and not have necessarily the reinsurance model be the only one helping those people. So that's one question. And second, the federal relief that was just passed did not include reinsurance. Yes, I understand Representative Craig at the federal level is pushing it, but that doesn't mean the entire Congress is supportive of that. Because there's other tools in the toolbox. So just to say one legislator, maybe there's plenty more. And I certainly know that she knows healthcare as her background. So I'm just really skeptical and wanting to make sure that we are transparent with our dollars, that people know that what we're paying for this and what we exchange for it, quite frankly, which is the essential healthcare back pay, which I think it's not a fair trade, because we have ARPA money coming in to help people on this particular issue. So I guess if you can respond to that, Senator Benson, thank you.
Thank you. And
Senator Benson.
Madam Chair, the Department of Commerce estimates that ARPA will help about 100,000 people. And that leaves about 60,000 people. And maybe some of them could buy in the exchange, but if they are getting employer contributions, they're not eligible to buy on the exchange. If it's their employer's, if their employer supports their purchase in the individual market, then they're not eligible to go in. And so disruptive to small businesses who are trying to help their employees, but also because of, dips in the way that premium costs are structured, there are going to be some people who, even with the 8.5% cap, are going to end up paying more because reinsurance had a bigger impact on their particular type of policy. And so there was nobody more disappointed, well, maybe somebody, but the people in the room when the letter came from the Trump administration that we would not be held harmless. So in January of 2017, I called CMS and I said, this is what we want to do. Will you hold our BHP harmless? And they said yes. And then in October, we got a letter that said, nope, changed their mind. And that fundamentally changed the conversation around how reinsurance was funded. Significant change in that conversation. We talk about the cost of healthcare a lot, but we don't talk about it as a cross subsidy. And until we're ready to step forward and talk about that, I keep talking about how reinsurance is necessary to keep from undermining support for our health system as it exists. Employer-sponsored coverage does the same thing. They pay higher than government plans do. And so right now in the individual market, that's where entrepreneurs get their coverage. That's where small business employees who don't have a group plan get their coverage. And so we're going to try to keep it bridged until maybe there is some change at the federal level or we get some clarity on the BHP.
Are you good? Okay. All right. Don't see any further questions. Senator Benson renews. Senator Benson, would you like to move the A3, please?
Madam Chair, I'll move the A3.
Senator, on Senator Benson's motion on the A3 amendment. All those in favor say aye.
Aye. Aye.
All those opposed, nay.
Nay.
Motion prevails. The A3 is adopted. Okay, so we have all of our amendments to date, unless there's more that we don't know about. Anybody else? No? That's good. Okay, members, what we're going to do is lay this bill on the table. And then we're going to go into recess. The House, I believe, is taking up the K-12 bill right now. And then we need to wait until they do that bill and the higher ed bill or the HHS bill. And then when they bring that back, we will amend the Senate File 37 onto House File 33. So we're going to amend this bill onto House File 33. Okay. So with that, we are laying this bill on the table and we are in recess till the call of the chair. Thank you.